everyone and welcome back to the channel. I'm Dr. Baptiste. I work as a portfolio GP, which means I work as a GP but also as a medical educator, content creator, researcher and more. In this video, I want to speak to you about a very important topic, antimicrobial resistance. This video is part of the CHAIN Pulse. CHAIN stands for the Content, Health and AMR Antimicrobial Resistance Innovation Network. This is a new media network led by the Fleming Initiative, which is a membership of clinician creators, communication experts and entertainment professionals. There will be more about CHAIN and the Fleming Initiative at the end of this video. So what is antimicrobial resistance? Well, this is when medicines, antimicrobials we use to treat harmful bugs do not work because the bug is no longer affected by it, resistance, hence the term antimicrobial resistance. How does AMR, antimicrobial resistance, occur? A common example will be using antibiotics when not needed during a viral illness. This means that when we actually need antibiotics, they may not work, which could lead to serious harm. Why is it important we draw attention to it? It's so imperative we highlight this issue because an example of such harm is people sadly dying from antimicrobial resistance. Bacterial AMR was directly responsible for an estimated 1.27 million global deaths during 2019 and contributed to 4.95 million deaths. If we don't take this seriously and start finding ways to address this issue, then AMR could be responsible for at least 10 million lives lost yearly by 2050. And this is more than cancer. Can you imagine a world where antibiotics do not work? Getting a common infection like bacterial tonsillitis and the antibiotics that should treat this doesn't, leading to common infections becoming life-threatening. So how can we start to solve this issue and control the spread of drug resistance? Here are some ways that you can help to stop AMR. Follow the instructions from your healthcare professional and take your antibiotics exactly as prescribed. Always finish the prescribed course of antibiotics unless told not to. Stopping your prescribed course early could allow some of the bacteria to remain in the body, reproduce and emerge as a resistant strain. Do not save them for later or share them with anyone else. For infections like coughs, colds, sore throats and the flu, which our bodies are quite good at fighting off on their own, you should talk to a pharmacist in the first instance before trying to see your GP. Of course, if your symptoms do not improve or you have any concerns, then get in touch with your GP or 111. Do not use leftover antibiotics or those obtained without a prescription. It is really important to highlight that antimicrobials, like antibiotics, should not be stopped. They should be used only when it is appropriate, and they should be used appropriately. We can also ensure we protect others, those who may be more vulnerable and susceptible to infections. Ensure you maintain good personal hygiene. Cover your coughs and sneezes with a tissue or your sleeve. Regularly clean frequently touched surfaces. Cover cuts and abrasions, which is where your skin might be worn off, with a waterproof dressing. Regularly wash and sanitize your hands. Always wash your hands after going to the toilet, before eating or preparing food, and after touching animals. Finally, a little bit more about CHAIN and the Fleming Initiative. CHAIN aims to harness the power and global reach of video-based online content to drive the behaviour changes needed to tackle the spread of drug-resistant microbes known as antimicrobial resistance. Founded on a partnership between Imperial College London and Imperial College Healthcare NHS Trust, the Fleming Initiative is bringing research, behaviour change, public engagement and policy together to provide real-world solutions to a global problem. You can learn more at www.fleminginitiative.org. If you found this video useful, then please like and share it with a friend. This will help to spread this important message and potentially save lives.